So join me today on episode 33 of Taking Charge of My Cancer podcast, and I have an amazing colleague with me today, Scott Capozza. So Scott received his Master's of Physical Therapy degree from Ithaca College in 1999. He has worked as a physical therapist in a multidisciplinary survivorship clinic at Yale Cancer Center since 2006, and is also Yale New Haven Hospital only outpatient therapist dedicated solely to oncology rehabilitation. Scott is among the first class of board-certified clinical specialists in oncology physical therapy in the United States and served as a SACE II Item Writer for the Oncology certification exam through the American Board of Physical Therapy Specialists. He holds several leadership positions within the American Physical Therapy Association, including the APTA Media Corps and the Academy of the Oncology Physical Therapy. Scott is the adjunct professor in oncology physical therapy in both Quinnipiac and Sacred Heart Universities in Connecticut, and has delivered lectures to physical therapy programs around the country about the benefits of oncology rehabilitation. He has presented professionally on the local, state, national, and international level. He has been co-author on several peer-reviewed publications. He's also the co-author on the chapter Young Adult Survivors in the next SACE book, Oncology Rehabilitation. So amazing. So this is so great to have you. Thank you so much for being here with us today.
Thank you for having me, Shirley, and it's great that you've got this podcast going, because I think it's a great resource, both for patients, for those who are going through a cancer diagnosis, but I also think it's a great resource for those of us, as physiotherapists who work in oncology, or for our colleagues, who are dietitians or social workers, APPs. And the doctors who work in oncology, who treat these patients, so that we're all on the same page as far as, what are the needs and concerns of cancer survivors, and what we can do to help them.
Absolutely, absolutely. So you want to tell us about your mission, like?
My mission is to make sure that I am providing comprehensive, collaborative rehab to any cancer survivor who walks in my door, and I want to include with that the idea of empowerment through education. Really, I think one of the most important things that we can do as physiotherapists is that we with the knowledge that we have in oncology care, sometimes we have to be able to predict the future. And so a lot of times it comes down to us to be able to sometimes connect these dots and to be able to fill in the blanks sometimes for these patients. The doctors and the nurses, they're trying to tell them about the different treatments and, the potential side effects that they might be having, but the patient's overwhelmed. And so they may only absorb 5 or 10% of that. And so if they hear that from us too, and plus we also can see the big picture when it comes to treatment.
Yep.
Right. If in a perfect world, we're seeing this patient from the moment of diagnosis through their active treatment, through survivorship, palliative care, end of life care. So we can be a constant, and because we can be a constant in their care, we need to be able to empower the patient through education so that they know that some of these adverse effects that they're having are legitimate, that they're not making this up, that it's not in their head. And then that way, then we can go at it and say, we know this is a real thing, and this is how we're going to treat it.
Yep. Yep. So, well, I want to thank you because I know you've been doing wonderful, wonderful things through the APTA. And I remember I hear about you when I was trying to prepare, like I was going through the process of the test. And you were like, the first one who jumped in to go in the unknown, no guidelines and all this scary part. And we're like, well, we're just going to let the first year survive. And then we jumping into the second year, and that's when I did it. And I remember, I was like, you were very helpful in regarding, answering some of these questions and how this whole process is going as you prepare for the exam. So, and it's a hard exam, right? With like any of the board certification exams, but I really, and I study a lot, but I learned so much going through the process. And I think when we have the passion for this type of population, you just learn and learn, and it's a non-end, right? So you are, always thinking about what else can I bring to the audience. And that was one of the reasons why I started this podcast. What else? I hear the pain on my patients day after day. What else can we put out there to help with education, to kind of help them to go through this journey as easy as possible? So I really appreciate that.
That's really nice of you to say, Shirley. And and you're right. Like, well, I mean, you and I both. I mean, we were part of the first couple of classes, and so we were kind of figuring this out, as we go. So maybe this might be a nice little tangent to go off of, to say for any of any physiotherapist that is listening to your podcast and and wants to take that next step, and go towards board certification. And honestly, I think, Darley, that I think this applies to anybody who goes for any board certification, whether it's oncology or it's neuro or it's peds or whatever it might be. That I think one of the things we need to think about when we're trying to study for something, a test of this enormity, is to find colleagues around whether they sit next to us in our clinic, whether they work on the same floor as us, or maybe we just know them some way, somehow, tangentially, and maybe they live halfway across the country from us. But to be able to work with PTs and study with PTs who do things that you don't do, right? Because I am not a lymphedema therapist. I'm not a CLT. And so it was really beneficial for me to study with two of my close friends and colleagues who are CLTs, because when I would have a question, they're the ones that would be able to answer those questions, right?
Yeah.
And they would also be able to tell me, you don't need to know that. Like, now you're down in the rabbit hole. We're going to pull you out of the rabbit hole now, right? Yeah. And so, so if you work in an inpatient setting, for example, you may want to study with somebody who's an outpatient therapist, because you're going to learn from that outpatient therapist what conditions they see, and how the flow of a clinic is and that sort of thing. But vice versa, you're going to be able to help educate that coworker to say, what do you do on an inpatient floor? Like, how do you manage the drains? Like, what are the immediate post-op protocols? Because the outpatient therapist,
we don't know those.
They don't see that, right?
Yeah.
So I would, to talk about the exam, right? That would kind of be my advice, for anybody, specifically for ours, for the oncology one. But yeah, I think that kind of goes for any of the specialization exams.
Yeah, and I did a study with one of my colleagues. We did it together, Annalise, and that was very helpful, because it's easy to work together. And but again, I have the fortune to have, like we mentioned, Shai in the beginning, doing the inpatient side with bone marrow transplant and all that. That was super helpful too, just because it's not something that you manage all the time. So that's really very beneficial. So you want to tell us about your journey?
So I went to physical therapy school a few years ago.
You're right.
And when I went through physical therapy school, and Darley, I don't know how it was when you went through physical therapy school, but they didn't talk about oncology rehab, because oncology rehab wasn't a thing back then. When I was going through PT school, exercise was contraindicated for patients going through cancer treatment. The patients were told, don't move, rest, right? I think you can appreciate that, right?
Yep.
I think any PT of a certain age can appreciate that. So even if I wanted to go into oncology rehab when I graduated from Ithaca College, it wasn't a track. It wasn't an option. It's not like we had clinical rotations or residencies or any of that at that point. But for me personally, I don't know that I would have gone that route. Anyway, because in my last year of physical therapy school, I was diagnosed with stage 2 testicular cancer. And so amongst studying for Neuro 2 and doing a capstone project and taking pediatrics, I had 2 surgeries for my cancer, and I had to undergo chemotherapy.
Wow.
And I don't know that I would have been in the headspace to have gone into oncology rehab at that point, because I was 22
Wow.
and I did not want that identity. I was happy with my labels at that point. I was a physical therapy student, and I was a runner, Red Sox fan. Like, I had all my identities, and I did not want to add cancer patient to those labels. So even if oncology rehab was a thing, I was not mentally ready or emotionally ready, because it was so raw for me at that time. So I went into pediatrics.
Wow.
Because, I mean, you talk about fate, because I had to do chemo, my last clinical rotation got pushed back.
Okay.
And so instead of, I think I was actually supposed to come to Tampa.
Oh,
I
wow.
think I was supposed to come to Tampa, Florida to do a hospital setting, and they had to cancel it. And instead, I went to a school system outside of the Washington, D.C. area. And so that was my last clinical, and I got done with that, and I said, "You mean you're going to pay me to play with kids? Sure, I'll do peds." So I was a peds therapist for 19 years.
Oh, wow. See, I did have no idea. I did have no idea.
Yeah. And for my journey, it took me several years to appreciate and understand the significance of being a cancer survivor, and understanding the significance of what I went through. And not everybody has the same outcomes as I did. And then start to connect the dots to see that, well, we're physiotherapists, and we have a skill set, and we have the ability to potentially help these patients. And again, because oncology rehab was not really a thing when you and I were in PT school, I never got PT.
Wow.
I never got PT when I was in the hospital. I never was seen by a PT when I was getting chemo. I was never seen by a PT post-treatment. And so that's when I started to slowly make the transition into oncology care. That's how I got my start in that survivorship clinic that you alluded to with my intro, where I just one day a week, I was working with adults post-treatment at a new clinic that we started here at the Yale Cancer Center in Connecticut. And after doing that for several years, I realized, well, this is great, but we also need to be able to refer these patients to PTs who, know what they're doing in oncology. And that's when the board certification started to come about, and that's when I really started to get more involved, and get more involved with APTA Oncology. So it was a kind of a long journey to get to where I am now, but I think that journey has helped, mold me into the therapist that I am today.
Amazing. Amazing. Something that I've been loving about this podcast, and every person I'm interviewing, I always learning. Like, I have no idea so many things that, like, you're thinking somebody. And so it's like, that's great. That's really good. Do you do any pediatrics oncology?
I never specifically did pediatric oncology. I for a bunch of summers, I would always volunteer at a pediatric oncology camp.
Okay.
So that would be my exposure to working with children with cancer, but never really working with pediatric oncology as a PT.
Okay.
I have not been able to combine that as some of our colleagues have around the country. But I think I found my niche where I am now, in outpatient oncology, and kind of considering myself a generalist. in the sense that, I will basically, other than lymphedema, I will basically see anybody that walks in the door.
Okay. How about you can give us 3 valuable tips, and that can go in both directions, right? You can give us 3 valuable tips that will be very helpful for the audience as a cancer survivor and as well as a PT going into the oncology world.
So I'm sorry, say that one more time, Dorley.
So how about 3 tips?
3 tips for the cancer. Okay.
As
So
a cancer survivor, as a cancer survivor, as well as a physical therapist working on the oncology.
So I'll start with the physical therapist part. So 3 tips is to, first of all, recognize that regardless of whatever setting you are currently in, you will be treating a patient with a history of cancer. It's not a matter of if, but when. With 18 million cancer survivors living in the United States in 2023, that number is only going to go up. That you can be in an outpatient ortho clinic, you can be in an inpatient rehab unit, you can be in peds, you can be in any setting, and you'll probably run across a patient with a history of cancer. And to recognize that that patient benefits from rehab. I would also say for our physiotherapy clinicians and our colleagues is to say that, it falls on us to advocate for our patients. We need to advocate so that these patients get rehab. And that might mean sending that email to the doctor, sending that in basket to the doctor, doing public outreach, in the community, maybe you're at your local hospital, maybe doing a social media post, right? It can look a variety of different ways, but we need to be able to advocate for our patients to say that, you don't have to live in pain. You don't have to live with, limitations because of your treatment. And then to put those 2 together, I would say that, one final tip is, that we're always learning, right? And so for physiotherapists, we always want to be learning through going through different conferences, by talking to each other, reading maybe one new research article, a week or a month or whatever that might be, because the field of oncology is always changing. There's always new chemotherapy drugs, there's new chemotherapy protocols, immunotherapy, surgical techniques. It's constantly evolving, and so we have to be on top of all that. So we can't just be stagnant in that respect. We have to make sure that we are, that we're lifelong learners for that. For cancer survivors, I think my 3 tips to you would be, again, you don't need to live in pain. You don't have to live with impairments, because there are physiotherapists out there who want to help you. And even if you're not board certified like Dorley or myself, I tell my students all the time, 80%, right, Dorley, 80% of what we do is PT.
Yeah.
It's just good old-fashioned PT.
Yeah.
The extra 20% is the nuance of knowing what the drugs are and like knowing the way it affects and everything. But if I walked into your clinic right now, Dorley, and I see you working with a patient, I don't know if I don't know you, I could say, oh, well, that person's got a shoulder issue, right? Or that she's working with that person with balance, so that person's got some balance issues. The nuance is, oh, well, that person had had a taxane-based chemotherapy and they got neuropathy in their feet and they can't feel their feet. That's why they're a falls risk. But our balance interventions are going to pretty much look the same. So that would be one of my first tips, is that that you don't have to, for the patient, for the cancer survivor, you don't have to live in pain and live with limitations. I would also say that, yes, to some extent, you also do need to advocate. The patient needs to advocate. They need to bring this up with their providers. They need to say, are you connected with a PT? Can you connect me with a PT? I need to see PT, and not just PT, but OT,
Mhm.
speech therapy,
Mhm.
a dietitian,
Yep.
right? A social worker, all of our colleagues, all in the allied health to be able to support this patient. So it is your right as a patient to advocate for that, to ask for that. And if you're not quite sure how to advocate for yourself, how to do that, bring a coworker with you, bring a friend with you, bring a spouse with you. Let them do it, right?
Yep. Yep.
Let somebody, like, if you can't find the words to articulate it, they'll find the words to articulate it for you, to be able to advocate for you so that you get those services.
Yeah. I do something that has been very helpful, because sometimes, as a patient, you come in and you just have, so we have the fortune, and I don't know if you guys at the clinic are doing a prospective breast cancer lymphedema surveillance,
A
but
little bit, yeah.
yeah, so we see patients, they get diagnosed with breast cancer, and 2 weeks later, I'm seeing them already for a pre-op. So it's quite fast. And at the same time, sometimes, the surgeons see them, and then I'm next one in line to see them. And then, so it's overwhelming, right? So many things in their head, man, I have cancer, I'm gonna die, who's gonna take care of the kids, or all these things that come when you hear that diagnosis. So sometimes I usually tell them, like, bring somebody with you, or I like, the family member or the friend, whoever comes with them. And that will be my advice to a lot of the PTs out there who is working with patients. And I don't know necessarily just oncology, but just bring that somebody else, because two brains can absorb more information than just one. Plus, you can start giving a lot of education to caregivers, right? Like you mentioned before, back then was, you have cancer, don't move, don't do anything. So the caregivers feel that way sometimes, like, and so it's a good way to educate them into, no, 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 no. They need to do stuff. And sometimes the patient tend to overdo. So it's a good way as well to educate, like, you need to slow down, after surgery for the first 6 weeks, you gotta have some little weightlifting restriction or whatever it is. But I think that's super important to just really as well encourage the patient and their caregivers to advocate for themselves. So I tell them, even if the doc comes in and only have 5 minutes, you just say, you don't leave this room without answering all these questions. And then you just start putting a list, and the doctors will respect that. So it's a good thing for you to start to really empower them as well, that it is okay to ask questions. It is okay to get a second opinion if they don't feel what they are hearing. Those kind of things, I think, is important, and we can help as well with that.
Yeah, definitely. I will tell you, sometimes, Julie, there are some sessions that I have with my patients where all we're doing is sitting and talking, and I'm answering their questions. I may not even put a hand on them
Wow. Yeah.
in my 30-minute session, but they still feel better when they walk out.
Yep. Yep. Yeah.
Because I have answered their questions, I've explained things, we've talked things through, we've hashed things out. They have a better understanding of what's going on. And so their stress was high when they came in, and now their stress is lower.
Yep. Yep. Yep.
Just because we're listening to them.
Yep. Yep. That's true. How about your most painful lesson that you have learned in this journey?
My most painful?
Yep.
Oh. Well, I will tell you, actually, I will tell you, I'll tell you a story, maybe go, this applies. My first clinical rotation as a PT student. I'm at a small hospital in Pennsylvania, and we had a child, he must have been 8 or 10, and he had chemical burns on his legs. And we did the kind of the traditional PT Hubbard tank, tried to do the debridement.
Oh, wow.
And yeah, and he was in a lot of pain, understandably so. And so I'm trying to this, and again, this is my first clinical. I'm trying to, to breathe some of the wounds on his leg. And he says, it hurts, it hurts. And I said, I know it hurts. He says, no, you don't. You don't have burns on your legs. You have no idea what this feels like. And I'm like, you're right. I have no idea.
Yeah. Yeah.
So I can't say that. I can say that in this position now, I can say that.
Yeah. Yeah.
But back then, and I think that that's an important lesson for all of us as physios, like, we don't necessarily have an idea of what that patient is feeling at that moment. So
Yeah.
we can't just assume and make those kinds of comments. So that was a lesson I learned early on. I definitely have learned, specifically for what we do in oncology rehab, I've learned how to come to terms, or how to deal with the loss of a patient. I think that's one of those things that, sometimes people don't go into this field because they say, well, isn't that so sad? It's cancer, people die. Yes, and I think that that's an important thing to note. We have to recognize that. We have to not shy away from that. But at the same time, we have to make sure that we have our coping mechanisms kind of prepared and ready to go when we do have a patient who passes away from cancer. So, so that's been an interesting part for me, especially as a survivor, that when a patient that I've worked with dies from cancer, that survivor's guilt is real, and it does kick in with me. And so I have to look within myself, and I have to realize what I need to do to process that in that moment. Again, separate myself from it, but also acknowledge, the significance of it. So that's been a bit of a learning curve for me as well, being a cancer survivor who works in oncology rehab, because yes, we do lose patients. We do have patients who die from their disease. And so to be able to know what, how are you going to take care of yourself in that moment is critical.
Yeah. And I cannot imagine, because I have not been on your shoes in regarding being a cancer survivor, but I've been on your shoes in regarding losing patients. And I remember when I lost my first patient, that was really sad. And it's funny that you mentioned when I did orthopedics and sports medicine for many years. And I've been doing oncology for the last 14, 15 years. And I remember when I was asked if I wanted to lead a program, if I was interested in oncology. And I'm like, I have no idea about oncology. And my first thing was, I'm a crybaby. Like, I cry so easy. And then how I'm going to deal with the sadness of losing somebody or seeing somebody, like I'm a pusher, high energy. How I'm going to do this with these patients? Because you're thinking they're going to be fragile. And when I came to the clinic and shadow one of my colleagues, Shannon, I absolutely fall in love with this population within the first week. I was like, oh my God, their energy, they're so grateful, it's just amazing. And that was absolutely the opposite than what I thought they were going to be. And here I am, like, loving it 15 years later. I'm so glad I made that change in my career. But one thing as well is, how do you deal with the fear, right? That's something I get all the time, right? Like, is this cancer coming back? Anything that I need to do? So from your standpoint, Scott, as a cancer survivor, how do you deal with that? What have you been done on, like, I'm sure that, you have to do some testing or anything that happened with your health, you get worried about that. So will you give us some advice about that?
So as the patient, yes, the fear of cancer recurrence is very real. And I would argue to say that anybody who's been diagnosed with cancer experiences some level of cancer related fatigue or cancer for fear of cancer recurrence rather, at some point, throughout their journey. I think for me, early on, I knew inherently, like now we have the research to prove it, but back then I inherently kind of had a hunch that being active, exercising, going for, I was a runner. And so I continued to run, when I was done with treatment, and for many years afterwards, I knew that being able to like physically take care of myself would help reduce the risk of a recurrence. And I use that now for my patients, because we do have the American College of Sports Medicine recommendations, and I pull those up all the time to say that we now have evidence that shows that exercise helps decrease anxiety and depression in cancer survivors, which can help decrease your fear of cancer recurrence. And exercise can help, reduce your risk of recurrence, specifically in breast and prostate and colorectal cancer at this point, which is great. We have that research now. We did not have that 20 years ago. I think for the patient, again, for them to educate them, not just on movement, which is what we are experts in as physiotherapists, but nutrition and regular screenings, regular follow-ups, be that with their oncologist or a primary care physician. Those are the things that we want to try to impart on our cancer survivors to help with that fear of cancer recurrence, to know that somebody's keeping an eye on you, but also at the same time that you have a stake in your own health. And by moving, so for us to be able to help them move, again, and for a dietitian to be able to help them learn how to eat nutritionally, and for a social worker to be able to help them manage their stress, that could all help reduce their risk of fear of cancer recurrence.
Got you. Is there anything that you have that will be of value for our audience that you would like to add?
I think one of the most important things to think about is, as the patient, you have a right to your health. And that means, again, advocating for your health, asking the questions, and specifically for what you and I do, Durley, to be able to advocate for rehab so that you can feel strong and move forward. And I think for our colleagues, our fellow physiotherapists, that, again, it's important to recognize that these patients have significant functional concerns, and that we are experts in movement, and we have the tools to be able to help them move forward and live a better quality of life.
That's great. And then how can people find you? And I will add that on the description of the podcast, but how can they find you?
So I am on Instagram, as well as Twitter, X, whatever it's called these days. It's at Scott Capozza, so just straight through, no periods, hyphens, or anything like that. You could probably find me on the Yale Cancer Center website as well. And my contact information is there as well. So yeah, those would probably be the ways to get in touch with me. You could also probably get in touch with me through the APTA Oncology listserv. So again, if you're a physiotherapist listening in, the APTA Oncology has a listserv. I know you've seen that, Durley, and it's great to be able for all of us to network around the country. So I can be reached there as well.
Okay. Well, let's go. We can continue on and on and on and on because it's been a great conversation. I really appreciate you doing this with me tonight. I really have fun.
I thank you, Durley. Again, it's great that you've you've taken this initiative and you're doing this podcast, because I think it's a great way to educate your audience, and your audience is so broad. It's cancer survivors, and it's physios, and it's other providers who work in oncology. It's family members. A family member is probably going to hear this at some point and say, "Oh, I just heard that most recent podcast, and they were talking about getting rehab," and then they share that with their loved one, and that's one more person that we can help.
Yeah, absolutely. Well, I really appreciate it, Scott, and you have a wonderful evening.
All right, Charlie, you as well.
You take care. Bye.
Bye.